My name is Jeff Schultz, and I am a professor of public health education. My role is it's twofold. I am a faculty member, so a large portion of my job is focused on students both in and out of the classroom. But then I'm also a committee member on various public health and otherwise committees on campus. But then one of my most fun roles is director of the Office of Health Promotion.
My name's Joan Cowdery, and I'm a professor of health education and public health and the graduate program coordinator. My role at EMU consists primarily of teaching in the undergraduate and the graduate public health and health education program.
My name is Amy Lewis, and my professional title is health educator. The thing that drew me to Eastern is I knew I would be able to get into Eastern. But when I got there, what I found was that I didn't just get in, I belonged there.
My name is Zaria Lewis, and my professional title will be NPH. I initially was attracted to this program actually as an undergrad. I wanted to be a part of the undergrad public health program, and chose health science instead. But then when I was looking for these programs, I found the health science program, which was going to become the public health program, and I knew it was going to be a good fit.
I think, many places offer a master's degree of public health. What makes ours different is that the focus is primarily on health education. With health education, what they're going to learn to do is understand what's driving the decisions that people are making and what's standing in the way of them living the healthiest life they possibly can, whether that be their own lifestyle or something in their social or physical environment, and help those people make changes.
I went through Pampers diapers to put changing tables in every building on Eastern Michigan University's campus. And that stemmed from, I was in the student union one day, and there was a mommy student in there changing her baby on the counter between the sinks. I contacted Pampers, and they had a program, and they gave us a grant for 25 changing tables, which they delivered to Eastern free of charge.
Absolutely, I feel 100% confident that entering the workforce, I do have that advantage, and I can do all the things that I need to do. Even with the current pandemic situation, all of our teachers have really worked on shaping our lessons around it, because these are things that happen.
Students come to the MPH in health education from many different undergraduate programs. Public health is interdisciplinary, and even within the field, there are so many different types of jobs and roles that you can really find your niche based on not only your undergraduate training, but your interests and passions.
The advice I would give a student planning to enter this program is that this is a service-oriented program. You will be called upon to serve a population.
One of the benefits to our program is that it is relatively small. For a student who wants to get involved and wants to get that experience while they're learning, we provide a lot of opportunity to be able to do that.
I think EMU is the right choice, the best place, for a real simple reason. The faculty really like to work with students, not just teach to students. We're always willing to share what we're doing and let students know that if that's something that interests them, then absolutely they're free to come on board, that they're not a burden, that we see that out of the classroom experience as essential as the in-classroom experience.